So, thanks, Ella.
Yes, thank you, Ella. Good morning, everybody. We are talking about, with Achim Hager, with healthcare transformation to personalized care, what that means and what are the opportunities in the future. And Vivaco and Vitatel, which is one subsidiary of the HF group, we have been working in cooperation already a long time now, and we are building this kind of e-health platform to Germany together. If we are looking about the digital transformation, what it means in practice and what opportunities it brings, it's actually that we can use the real-time personal health status information and use that also with the help of the personal background information, and actually with daily monitoring use that also in the preventive real-time information. And one important thing is also the adaptation, that the monitoring needs to adapt to the single person. So you will get really personalized care, not just a general or statistic care, because then the treatment can be tailored for you. And of course, this is just the beginning of the journey, because what we see in the future is that when we can combine different people, different backgrounds and the genomics, it will bring more and more information about what is your health status and what is your condition, which direction it's going, and how your personalized care can be tailored and also improved. And of course, if you think about that, what are also the big benefits in the future is really that you get very personalized care, but at the same time, we will receive a big results from the efficiency of the care. So care is tailored based on your background, your real-time information. And of course, at the same time, when we receive the information in the real time and preventively, we can also improve in a big way also the functional efficiency of delivering the care. So that's really the important and interesting road where we are going with the healthcare at the moment. It is a little bit similar than used to happen in the manufacturing industry earlier days. So there is a lot of information collected with the sensors and background, and the manufacturing is nowadays pretty much fulfilled and developed with the help of the data and real-time data. And I see this now as a step that we can move forward also in the healthcare area. And actually, even I cannot really think that what this will bring in 5 to 10 years, what kind of benefits we will get from the health transformation. Then if you think about just that, okay, how this will happen and what are the steps? So basically, if you think about the healthcare processes, the key is that you can use the analytics real time. And for example, when you have had an injury and you are in the acute care, well, we need to monitor the vital signs. We need to monitor a lot of things related to medication and surgery. We have standard protocols how to do, and also the surgery also, they are prepared for the deviations. So you need to have the plan B and plan C. But then nowadays, it's still many times the monitoring stops when you get out of the OR. And also the rehabilitation itself, the role of the rehabilitation has been changed quite dramatically last few years, because there is more and more data showing that actually during the rehabilitation, you should be getting up as soon as possible and start to working. So not anymore that you are in the hospital several days lying just in the bed. So the processes and learning about this has been changed a lot. But also at the same time, the key, for example, in the rehabilitation is that when you can get really good rehabilitation, you need to have the good sleep. Because the good sleep means that your brains will be covering. And for example, after the neurosurgery, it is really the critical. First get to the sleep right, and then you have the energy in order to have the physical rehabilitation functioning well. And then the opportunities that the monitoring brings, real-time monitoring brings in the future is also that after the discharge, the same monitoring can be continued in the home. And actually the doctors in the rehabilitation and the nurses, they can follow up the same rehabilitation process in the same manner in home. And what they can follow up is the sleep, physical functions, how that is going, the circadian rhythm, but also very important thing is the medication. So what are the effects of the medication? Are the medications suitable? Will there still be some pain, for example? If you have the pain, it actually doesn't help you to recover, and actually your sleep is worsened. So it's very important, and new monitoring data can really bring this very efficiently up to the caretakers, and they can use this information in a very beneficial way, both nurses and the doctors. Then if you move from the single rehabilitation to the larger scale, we will actually have a huge amount of data about the different rehabilitation and different people. So this is one example about the dashboard, having the different segmentation of the people based on their physical functioning, the condition, and at the same time, the sleeping periods, the sleep amounts, also how much they have this kind of health changes, and for example, how much they have also alarming. And when you build up this in a larger scale, you can start learning, for example, how the people in this segment, how they can be helped, how their functioning can be improved, and what are the backgrounds. And you can, for example, start picking up the also the persons based on their other health statuses, for example, who has the diabetes. And this, in a larger scale, brings for the healthcare providers much larger scale, actually in real time, look at the care efficiency and where they should focus their resources. Then if you go back to the really practice, which are, for example, the areas that you can provide the digital health. One big segment that Vivaco has been working many years is the elderly patient. Typically with the elderly patients, if they have issues with the sleep or activities, their health status is typically dropping, they feel dizzy, and they have much larger risk of the accidents. And the key thing is that it's known enough early. So the rehabilitation, physical functions, the daily activity, when it's improved, we can also tackle these issues with elderly people having the problems with the accidents. And of course, the other angle is really the medication with the elderly people, because the hemodynamics of the elderly people is working differently, and the adjustment of the medication is very important. So avoiding over-medication and also under-medication. And also the other areas if you think about which are very beneficial with this kind of monitoring, is the rehabilitation, discharge, occupational health, for example, if you have the stress problems, sleeping problems, and of course the mental health issues. And then you can use also this in the research, because then you have the exact objective data, and the people feeling about their sleep is quite different than what you get when you have the really exact measurement. And of course, from the user's perspective, it is very important to tailor the services so that it's very easy, comfortable, and everything should be in the digital world very automatic. So you shouldn't be taking much time in order to have the information. You just start using the system, and the system can automatically collect all data needed. And this brings very interesting future for us. And now, Achim, if you can tell about the...
I come over
German.
to you.
Yes.
And our joint venture also went through the combination of the Finnish influencer and the German influencer yesterday evening. So my voice is not the best today. Vitatel is the youngest of our subsidiaries of the HFO group. We exist since 21 years and experienced in the fields of IP communication. That's where we come from. We're providing all over Germany and we're selling all over Germany. And 2.5 years ago, we started the cooperation with Vivago. And I'm glad to be here. We have also an interesting joint venture with Sweden about cloud communication, but what's not the topic today. And we found each other and decided to make market in Germany, how to monetize all these good ideas. And it's very interesting to see what happens in the Nordic countries, especially in Finland. In Germany, everything is a little bit slower and the market is conservative. And I said to the Ministry of Health, until an innovation has admission to go into the market, the innovation is no longer innovative because it lasts too long, 2 years, 3 years of admission time. That's really a long time. The classic Vivago Domi solution has, meanwhile, the admission of the health insurances in Germany. So we can address the care providing companies with the traditional form of the watch, not with the Move, but we combine through Bluetooth with a normal Samsung mobile phone. But the classical functioning watch is, meanwhile, it has admission for the German market. But politically, the care market is the #1 topic. There's no day without a headline about care companies, about 2 less people in this field, about 2 less employees for the demographic situation in Germany. And we will have 10,000s of people lack in the next 20 years in order to take care for our elderly people in Germany. Interesting is the statistics. It's from the WHO. Made in Hamburg by a professor. The revenues in million euros are climbing, and especially what's interesting are the emergency services that we have not spoken about today. It's all about monitoring, but it's also a system to make an emergency call, a proactive emergency call, not through a button where the patient must put on, and if he is not able to put it, then there's no help. That's another thing with Vivago. The system recognizes if there is the need of an alarm and makes it proactive, and that's very, very interesting. So within 30 minutes there is an alarming, and the market of alarming is the biggest one compared to emergency buttons and the pressure mats. And that's the same with the complete overview over the ambient assisted living market. The expectation of the next 4 years in Germany, you can see that the growth is by 38% of the emergency services. Also interesting with all the other things in this market, the pressure mats especially. But all these statistics show us that there is a need, and the people got to know all these things, and it's up to us now to monetize this and bring the things into the system, into the market. And an overview over Germany. The Germans are especially interested in apps especially for emergency services or for health data measuring, like it's also available in other smart devices. Interesting, emergency is the biggest one with 42%, and track fitness, of course, 40%, and also this, the topic sleep tracking with 35%, what's all within the Vivago watch. This was a question how the smart health devices were used in the past 12 months in Germany. 62% of the Germans have used a smartwatch in the last year. That's a lot. If you compare it to 5 years ago, where no one had ever used these things, it's an overwhelming success story, these smartwatches. And the sleep tracking systems with 9% are far away from this. And if you combine this smartwatch with a sleep tracking system, with a care phone system, I think that's very, very interesting and outstanding USP to have it all in one device. And the only thing interesting in this last statistics is the thing below. The smart emergency alarms that only have 9% market at the moment have a huge amount that's standing before us, in front of us. 66% of the people in Germany can imagine to use it in upcoming times, and the willingness is there. We only have to bring it to the market. And this is all about Vivago that we've heard before. You have the mobile application where you can see the health status data. We can track the activity, the sleep rhythm, the circadian rhythm. That's clear. We combine it in Germany with a 24/7 emergency call system, the call center behind it, where every alarming is there, and you can see in the system how the patient behaves and what's his current status. And in the center there's the move where all the things are tracked with. We have two solutions. I told about it before. It's the Care Watch with admittance together with the DOMI system, and we combine it with our M2M connection. We are M2M service provider for Telefónica Spain through our cooperation since, meanwhile, 20 years. We start this with M2M in Germany in 2019. So we transfer all the alarms through the new M2M system. And this is also interesting for the press, of course, because eHealth, M2M, you need some good headlines today to be in the market and to be recognized by the people. And what is interesting all about is that this watch is not stigmatizing. Because if you sell a normal emergency button, let's be honest, most of the elderly people think, okay, that was it. Next 12 months, I'm away from the world. And this is not an stigmatizing thing. You can use it maybe up to 65 years and older, but not with 90 years. So it's interesting that the group is willing to use it. And you can, what is uttermost interesting, you can integrate the relatives because they see the status of the relative on their mobile phone, and they can also react to an emergency. And the model, it's the last one. I have 1 minute. Yeah, it's just in the time. We have a target group in Germany of 14,700 care organizations. That's a lot. 1/3 is completely free and organized in an association of these free care organizations. And we want to integrate this alarming and health monitoring service into their portfolio to upgrade it, to make a better service, to be nearer to the patient. It's a clear USP for them. And we give this customer ownership to these care organizations. We are only the service provider behind. No one can see us. And we will address all these organizations through our partners in Germany. We have about 1,200 selling partners of the HFO group. And these partners have been approved or will be approved and taught how to sell these products. And the partners have these care organizations still as their customers. That's what I want to say, tell you about the German market in a short overview. Thanks a lot.